Dr Shane Retty.
Thank you, Mr Speaker. It's a pleasure to speak to the Substance and Addiction Bill, a bill that looks to help people who have severe substance addiction and substance problems get assessment and treatment. And I mention both of them specifically because we've all gone to the compulsion to treatment. Just remember that the first step is actually the compulsion to assessment. And certainly I found that the most challenging when you're on duty after hours in a city and you get called by the DAO, which was the 1992 definition, the duly authorised officer, to come along with them because they've got a patient they're concerned about. And you go out the back of a block of flats and there's this really large male in various stages of undress and clearly not coherent. You're always sort of very mindful and grateful to have the experts around you, but you're stuck with what the step is. The step to assessment was very complex, it wasn't clear, and we're looking at each other saying, well, who does what? What's the next step? Clearly this person needs assessment. Well, this looks to clarify that, and that gives us the opportunity to talk about that pathway to assessment, because I believe once people have touched the system and got specialist attention, generally the best outcome that can happen generally does. So I think when people have, what this bill says is when people have a loved one or someone they're concerned about who has substance abuse, often one of the first contacts is what the bill's calling an authorised officer. And that'll be a health professional, and that professional is appointed by the area director, and the area director makes sure there's always enough authorised officers in the region. The first thing that authorised officer does is to seek voluntary compliance from the patient. Is there a way that you can help them with their own consent? If that fails, Mr Speaker, what then happens is the authorised officer approaches a medical practitioner, and that medical practitioner has two tasks. The first is to assess whether that person has severe substance abuse, and the second is whether they have capacity to make informed decisions. Now, as has been mentioned, there's 4 criteria for whether a person has severe substance abuse. 2 of those 4 criteria are required. First one is neuroadaptive changes. What that basically means, with substance abuse, Mr Speaker, the common pathway is dopamine in the brain. And what neuroadaptive changes does, or what it means effectively, is you get downregulation of the dopamine receptors. You get less of them, and they become less sensitive. We know that as tolerance. So they're looking for evidence of that, craving, unsuccessful attempts to control the use of the product, and ongoing use despite harmful consequences. I think the second criteria, the capacity to make informed decisions, can be quite complex. There's a lot of discussion, contemporary discussion around what autonomous decision-making means. But I think there's a good piece of work here saying, look, to understand the relevant information, retain that information, and be able to communicate that decision. What happens then is the medical practitioner has to document their findings. They have to attest that they're not a relative of the applicant or of the client themselves. Now, if for any reason you can't get a medical practitioner to do that, the authorised officer is able to do that by completing a memorandum. The authorised officer then makes the arrangements, and those arrangements can also involve the police, and then the person enters the system. They're able to be assessed, and hopefully the best of care can be attained. Mr Speaker, I think this adds clarity to an area that I've personally found in practice to be really complex. And when someone's shouting and when they're threatening you, often it's unclear as to who does what. I believe this adds clarity. I personally have no issue with compulsory incarceration or detention for treatment. When you see some people who are clearly a harm to themselves and clearly a harm to the public, you just want to get them back to that state where they can make their own decisions, and however you do that in a clear and concise way, I think is a good thing. So, Mr Speaker, I think at its first reading this is a good bill, and I support it and commend it to the House.